Welcome, everyone. Thank you so much for joining us today. My name is Dr. Louise Ivers. I'm the director of the Harvard Global Health Institute. I'm delighted to welcome you to HGHI's virtual series, Coffee Sessions. This is a series that's designed to explore and discuss the role of partnership and collaboration when working to advance global health equity. We welcome you today and to mark your calendars to join us on the last Friday of every month for our sessions. Today, we're going to have time at the end of the presentation to answer attendee questions. So if you have a question, you can submit it through the Q&A feature on the bottom of your screen. Today's session also includes translations from Gujarati to English. If you would like to listen to the English translation, please click the interpretation button. That's at the bottom of your screen, and you should check the English audio channel or the Gujarati channel if you're listening in that language. It's my pleasure to welcome our guests today. They are representatives of the 3 million strong Self-Employed Women's Association, SEWA, Kapilaben, Vankar, and Manshi, Shah. And they are in conversation with Dr. Satchit Balsari, Associate Professor of Emergency Medicine and of Global Health and Population at Harvard. And the SEWA leaders will describe how and why they chose to collaborate with Harvard researchers to document the impact of the pandemic on the lives and livelihoods of SEWA's working women. Dr. Balsari will describe how a post-disaster impact evaluation evolved into a multi-city traveling exhibition and why his team believes this kind of storytelling is very important. Strong bonds of mutual trust forged between the two institutions have also resulted in SEWA's members asking researchers to help address critical gaps in the science of climate adaptation strategies available to the world's poorest communities. And together, they have deployed what is on track to become the world's largest data set on the impact of heat and humidity on human physiology, well-being, and work. So I invite each of our speakers to turn on their videos so we can see them. And please allow me to introduce each of the speakers. Manshi Shah is the Senior Technical Coordinator in Rural Economic and Development Sector at SEWA and the Program Manager for SEWA's Future of Work activities. Manshi has orchestrated and led several workshops and roundtable conferences with poor women workers from the informal economy on the nexus of women, work and energy, women, work and climate action, as well as the role of informal sector women workers in food systems. She has assisted in drafting the strategy for SEWA campaigns to build climate-related member resilience and represented SEWA at various international workshops, conferences, and policy dialogues, such as COP27, Global Forum on Adaptive Social Protection, One Planet for Fourth Global Conference on Sustainable Food Systems, UNFSS Stocktaking Moment in Rome, and many others. Kapilaben Vankar is a grassroots leader and has been a member of SEWA for 22 years. She was previously president of SEWA, where she helped drive the organization's membership to over 2.5 million across 18 states in India. In her role as the president, Kapilaben represented SEWA's members, their challenges, and their struggle for voice, visibility, and validity at various national and international forums and platforms. Dr. Satchit Balsari is Associate Professor in Emergency Medicine at Harvard Medical School and Beth Israel Deaconess Medical Center, and in the Department of Global Health and Population at the Harvard T.H. Chan School of Public Health. Dr. Balsari's research and teaching are focused on complex humanitarian emergencies and digital health implementation science in resource-poor settings. Dr. Balsari co-directs CrisisReady.io, a research response platform that builds data-driven decision tools for local communities and response agencies affected by disasters globally. He is the founding director of the Tri-Institute Climate and Human Health Fellowship at Harvard, leads the climate platform at the Lakshmi Mittal and Family South Asia Institute at Harvard, and is co-investigator on the Salata Institute's inaugural Interfaculty Cluster Grant on Climate Change Adaptation in South Asia. With that, it's my honor to turn it over to Satchit, Manshi, and Kapilaben. Thank you.
Dr. Ivers, thank you so much, and thank you for inviting us to this exciting coffee session this morning. I will dive straight in. My first question is to Kapilaben. The SEWA team had approached the Harvard team to do an impact assessment of the pandemic on the lives of working women. The various aspects of their lives that were particularly constrained because of the nature of the pandemic in India, marked by the lockdown and then the devastating Delta wave in 2021. Why an academic partnership? What was this research evaluation going to be about? Why was it important to SEWA?
Greetings to everyone. I am Kapilaben Vankar from Anand, and I belong to Rasnol, Anand, and I have been associated with SEWA for past 23 years. So when I talk about COVID, when we mention that it's about informal sector women, it is not only during COVID, but women have been suffering from brutal blows since the beginning. But the blow faced by COVID was not only on their health, but health, livelihood, food security, mental health, and everything. So what happens is when it is their day-to-day income that was started getting impacted, their children's education and everything else started getting suffered, in addition to their lives and livelihoods, plus assets getting drained. So what happens is that when we approached Howard because Satchit Bhai and their team not only were having their expertise in dealing with health and healthcare sector, but they could also incorporate the informal sector women, the impact of social lives and security and daily livelihoods on their lives. So what happens is that we could then highlight each and every sister's trouble faced during the pandemic, which can then facilitate change in the social sector.
And a lesson that I had learned early on in my engagement with SEWA was these recurrent terms of projects with SEWA being needs-based and demand-driven from the grassroots. Manshi, we came to you in response with a quantitative survey, wanting to survey 1,000 households, to be followed by in-depth qualitative surveys. Can you share with our listeners what that process looks like internally at SEWA when the researchers then come to you with a proposed plan?
Thank you, Satchit Bhai. At SEWA, all our SEWA's approach has always been a participatory approach. At all the whether it is a study, whether it is a program, whether it is an initiative, is always designed by the members, for the members, and it is of the members. And this research was no different than these others. And therefore, when Harvard came up with this tool to conduct this research, we wanted it to become participatory, and therefore we took this tool and we went with our members. We conducted a series of focus group discussions with our members in villages, in cities, in urban areas, from different trades, from different demographies, to understand whether this questionnaire, this study tool, is it relevant? Will it help in bringing out what are the challenges the members are currently facing? Do they agree to this questionnaire? Do they want to add something? Are they comfortable responding to it? So this is how we helped in, we tried to shape the questionnaire to actually bring out the needs of the members. Secondly, we have also seen in our experience working with these women that generally all the studies, the researches are all top down. But when you try to, when these members, these poor women from the informal sector, when you are asking questions regarding their lives, their livelihoods, the members need to really be comfortable. They need to feel secure when they are responding to these questions. And therefore, we mobilized a cadre of grassroots researchers whom We trained with your support, of course, however, and All India Disaster Mitigation Institute support. And we trained these grassroots women as grassroots researchers. And this cadre of grassroots researchers were the women who went into the fields, into the villages to collect this 1,000 households data. When these women who came from the same community as the respondents of the survey, when they conducted this data collection, the respondents, the women, the member of SEWA, they felt very confident. They felt secure that the data which they are sharing is going to be interpreted exactly in the way what they are sharing. It will be understood because the researcher comes from the community herself. She would understand what the feeling, the bhav, we call it in Gujarati, behind the response that the member is sharing. And that is why the whole part, this is what at SEWA we mean by grassroots research, participatory grassroots research. So yeah, this was the process that we followed.
No, thank you. And you brought up bhav, or the sentiment of what folks are saying, and I think we struggle in our classrooms to help appreciate that data, as now understood in this day and age, are just a small piece of the puzzle, right? And there is so much that is behind these data, and it is important to understand context, and that data are never ever context agnostic, as much as we would like to make generalizable models. That sense of sentiment is what I experienced while collecting the qualitative questions. As you know, we were testing the qualitative instrument. We were done with these 1,000 households, and we had about 12 questions per interview. And I remember sitting there to the first interview or two, recognizing that the instrument was completely going to fail. I did not get past the second question. The women would look me in the eye and speak extemporaneously, experientially for a good 40, 45 minutes. And what I realized there is not only will the sentiment or the bhav be entirely lost were I to just jot all this down, but if I try to retell the story, or if my team tried to retell the story, I think English transcripts in dry scientific manuscripts would completely miss the point. And so we switched midway to instead collecting these oral histories, and we have 30 hours of recordings of the SEWA members describing what impact the pandemic had on their lives, on their livelihoods, on their wages themselves.
That's very helpful, Satchit, to describe what you just, to share what you just felt. But I also wanted to understand why and how did you think of this, converting this outcomes of the study into an exhibition? I mean, that's something I don't think it has been done before. So
I learned from SEWA, and we'll share with the audience a small clip of the exhibit as we continue this conversation, so you have some context. When I had these oral histories, by then I had learned from this grassroots organization that they would have a strong opinion about what we do with the research and the analysis, right? And I was very lucky that you all had scheduled a Karobari meeting, which is your leadership meeting. And I was invited to the Karobari meeting, and I shared what I was hearing in the oral histories, and asked the women members and the leaders what they would like to do with the oral histories. And they were very prescriptive. The first response I got was go to Rome. And I was puzzled. I was wondering why the Pope wanted to hear about this. And they said, no, the International Labour Organization is in Rome. Go share our stories with the ILO. And then they said, well, go to the large cities around the world, go to London, go to Paris, go to New York, show the Indian diaspora what their actions and inactions do to our lives. And they said, come back to the villages in India and show our neighbors what they do. And that was the genesis, right? So we're now looking at a format, and that was a mandate from the SEWA members. The question in academia is, why do this, and where do you stop, and sort of when is the deliverable complete, right? The ask was do the assessment. And my team felt that the arithmetic wasn't adding up. If we did a 1,000 household survey, and the SEWA members were the enumerators, that's 2,000 hours invested from SEWA, and then the 30-hour oral histories plus commute time. And we felt that in this day and age, when we're talking about decolonizing global health, equal partnership, community engagement, perhaps the least one did was made sure that the foreign university, engaging with a grassroots organization, returned the time and the sweat equity that was put in by the organization itself. And graduate students at Harvard have phenomenal imagination and capabilities, and so what we landed up with was the exhibit. I wanted to invite Kapilaben back into this conversation because she was here and she saw the exhibit. You heard my side of the story, but Kapilaben, you came to the exhibit. What was your response, and does this do anything for SEWA? I mean, it was an extraordinary experience for the team and for the students and folks that attended it. But what did it do for SEWA?
When I visited Boston and when saw the exhibition, when I entered the thing, the first thing that I witnessed was the timeline. That was from 1972, the date when SEWA was established, to 2024. And it was all done chronologically. That just made me overwhelmed. Like, from bottom of my heart, I felt that the voice, visibility, and validation that SEWA is planning to provide informal sector women workers with has been now fulfilled. And it not only provided them with this, but an identity to the struggle, their hard work that's been put in, and the amount of efforts that they put in to sustain on their daily lives. In addition to that, since this is a moving exhibition, I would like that these exhibitions are being put across to people belonging to World Bank, ILO, and other stakeholders from other social sectors, and including, we also wanted to come to SEWA. The reason being that the impact of COVID was not only to their livelihoods, but on their various spheres of life. Second, ILO, because in addition to have labor laws and policy advocacy measures for members, it is important that the struggle that they face gets highlighted, and to facilitate peer-to-peer learning. In addition, to facilitate members with their holistic development. The amount of hard work that has been put in by SEWA and the Harvard team together was rightly exhibited. And when this gets a visibility to the world, what happens is that the SEWA sister, who has been working throughout their life, what happens is that they feel proud that, okay, our struggle is getting highlighted and members across the world are learning. In addition to this, the exhibition facilitated collection of data, which has provided with a robust foundation to the struggles faced by members in terms of health, education, livelihoods. So when I visited the exhibition, I felt proud that all our sisters have now got a visibility and validation plus an identity. And the members and people who visited the exhibition appreciated this. That just made me overwhelmed. And from bottom of my heart, and 2.9 million members at SEWA, I thank you and the team.
Kapilaben, we were so honored to have you on campus. One of our poignant memories is that there are two, in fact. One is you standing on the stairs that are coming down and looking at the SEWA pandemic timeline and taking a photograph of the timeline. And that's one of our favorite photos. And the other is, and Manshi, I wanted to share this with you and the readers. There are so many intangibles to this kind of circular accountability between organizations that collaborate across the West and the Global South, where when Jyotiben came to, one of the other SEWA leaders, the General Secretary, came to the exhibit, she shared that it brought her closure. validation of the personal loss she had felt, the family members, the friends that had died, and to have that publicly acknowledged felt very important to her, and she had not expected that, and we certainly had not anticipated her saying that. Kapilaben me kiddu ke jere Jyoti ben આવ્યા ત્યારે એમને કીધું કે એક્ઝિબિશન જોઈને એમને એવું બી લાગ્યું કે બહારથી દુનિયા એમનો જે લોસ થયો હતો તે એકનોલેજ કર્યો કે આ બહેનોમાં આ અસર થયું તે બધાને જોવા મળ્યું. Manshi Ben, can we switch gears as we wrap this discussion and transition over to our audience soon? We had a second round of engagement with SEWA. The first was initiated by SEWA. It was needs-driven, demand-driven, needs-based. When we were conducting these interviews, a recurrent theme was climate change. And there are manifestations of climate change in the working poor that are due to the unseasonality of the rain. It's not just more rain and less rain, it's unseasonality of rain. But heat was a recurrent theme. And as we've seen in news headlines around the world these last couple of months, extreme heat waves have become a lot more common than they used to be, longer durations, harder. So we proposed a study that wanted to quantify the impact of heat waves in the lives of the working poor. We felt that global projections that talked about an average of 1.5, 1.2, or 2 degrees completely missed the point and were hard to localize for communities in situ, in the workshop that they're working, on the farms, on the construction sites, on the salt pan workers. And so our study was to put thousands of sensors in the lived environments of the poor, as well as physiological sensors on their bodies to measure the impact of heat. It's an invasive, ambitious, audacious project. How did you respond? Why did you all agree to do it? We were a little hesitant when we came to you because it was a big ask from the SEWA members. And it totally flipped how the project was originated. This came from recognizing what was happening with the members, but it was certainly an outside ask. Can you share sort of what the internal deliberations were like?
Definitely. Thank you, Satchit Bhai. And that was, this is actually very important because, previously we were talking about the pandemic and the exhibition, which was around the pandemic study. For a large portion of the people in the world, the pandemic ended and so did the challenges. But our experience working with these poor women is that the challenges, they do not stop for the informal sector poor women. And the climate crisis that you just mentioned, the heat wave, is one such example. Over the past 3 years, we have seen that the climate shocks are increasing both in frequency and in intensity. And these shocks are disproportionately impacting our members. The members I'm talking about are the street vendors, the construction workers, the agricultural laborers, the waste recyclers. These women work almost 8 to 12 hours in hot sun. This year, in India, we face the worst ever heat waves. Temperatures cross 52 degrees Celsius. And generally, what we see is that heat impacts your capacity to work, it impacts your health. But how does it actually, when we see our members, we see that it impacts their lives, their livelihoods, their work security, income security, food security, and the list just goes on. And so this proposal from Harvard, while you might say that it's an invasive proposal, invasive study, we saw it as an opportunity. Our members always say that there's always an opportunity in any of the challenges. Last year, we piloted the extreme heat, the first ever extreme heat wave parametric insurance for our members with 21,000 members across various trades of our membership. This year, we scaled up the pilot to include 50,000 members and variant trigger point temperatures. And you all might have heard it read it in the newspapers, heard it everywhere in the news that the insurance did get triggered and over 46,000 women got a payout compensation on an average compensation of $10 to $12 which from the heat wave insurance. But it's a success, but there were a lot of challenges. How do you bridge? One of the biggest challenge that we face is how do you bridge the gap between the satellite data and the micro level data, the experiential data that the members are facing? And this study that the Harvard Institute just came up with, this was the answer to that question. The study included using atmospheric sensors, which are being installed both inside the homes of the members as well as in their workplaces to capture the impact of the atmospheric changes. At the same time, it also includes wearable sensors, which the women are wearing, which measures their heart rate, their physical activities, and their sleep, most importantly, their sleep patterns. Because, when a person sleeps at night, it is the time when the body recuperates. It's the time when you regain your energy and you're ready to face the challenges next day. But the heat, does it allow the women to actually recuperate? And this is the study which will help us bring out these challenges. It will help us in advising the design of this insurance product and many other innovative products, financial products, which SEWA will work on in future to build the climate resilience of our members.
Thank you for sharing that. As you were going through those deliberation processes, at our end, we were pushing for a 13-month, 18-month, just baseline data collection before we measured anything. And the lesson we learned, and I have throughout engagement with SEWA, as has the team, is it had to solve immediate problems for the working poor as well. Right. So SEWA leadership understood why the physiological baseline was necessary, but that was not enough. The greater good is fine, but it's hard to worry about the greater good when you're worried about, food on the plate at dinner. And so I want to share that what came back from your team was a clear mandate saying, well, what are we going to do here and now in this summer? And how does it help us measure our adaptation interventions? And I think the parametric insurance is a case in point where it didn't get triggered last year, despite it being the hottest year on record. So much to be done. And this engagement for the last couple of years with your team led to my colleague Caroline Bucky, who co-leads this study with me, to insist that a byproduct of the study is a toolkit that can then be used by community organizations on their own without dependence on large university organizations, right? And so what will come out of the SEWA project is also a bunch of hardware, software, and instructions for SEWA to replicate these studies and further adaptation measures. And I confess that may not be something we would have thought about without this initial engagement. All right, lightning round. One last question, less than 1 minute. Okay, what advice do we have for other community organizations, or what lessons would we like to share based on this partnership with other universities or community-based organizations? Kapilaben.
The only advice that I'll give to these people, that the partnership that SEWA and Harvard had, the exhibition that we did and what people saw, there has to be more partnerships established so that we can maximize the outreach, maximize the impact, and facilitate better learning in order to ensure that the members belonging to the informal sector get proper voice validation and visibility. It doesn't mean that if the pandemic is over, that their lives are at ease, but they have more and more issues that are compounding the ongoing consequences of the pandemic in their life. So as SEWA believes in a bottoms-up approach, in addition to ensure that the policy advocacy measures go right, it is important to have more women members represent on the table.
Centering the needs of the communities that we work in, and different political social movements have reflected the same sentiment, right? Nothing about us without us. Over to you, Manshi, then.
No, I would just build on what Kapilaben was sharing. And I feel that my message to the research organizations, other researchers, is that they should learn from this study, and that research, if it is participatory, it is more impactful. Research needs to be flexible to understand where it goes and what is the objective. How does it help benefit the larger data?
Thank you kindly. I would like to invite Dr. Ivers back into the conversation and open the floor to the audience.
Well, thank you so much. This has been really informative, and I've been learning a lot. I think there are many questions we could have for you. I'm going to continue to invite the audience to submit questions. And meanwhile, I would like to start with you, Manshi and Kapilaben, with a question I have. Can you tell me a little bit about the grassroots researchers, a little more about the grassroots researchers, and how, as a large organization with almost 3 million members over 18 states, you solicit interest in being a grassroots researcher, if that was very easy for you to do or difficult, and how long the process took, and as an organization, how you managed to do that. Thank you.
It was a little difficult because we are at present helping train the next generations, the younger generations at SEWA. So whenever we are training these grassroots leaders, we need to keep in mind the morals and the basic values of SEWA in mind. But towards the end of the day, it's always like all's well that ends well. So all the problems that are being faced by SEWA members have been going on from ages together. But towards the end of the research, the data that helps build upon policy advocacy measures is really good.
Thank you, Kapilaben. And I would like to add to what Kapilaben was sharing. And at SEWA, we've always felt that the research should always be bottom up. Unless you involve the community into the research, the context of the data is generally lost in the translation or interpretation. And therefore, over the past 50 years, SEWA has been doing this process. We have set up our own research academy, and where we have a standard process of training a cadre of grassroots researchers. And these researchers, they not only collect data for SEWA's for researchers like Harvard Institute, but also for SEWA's internal researches, and based on which we design our programs, our initiatives, and also do a lot of policy advocacy work. These grassroots researches are what help us in bridging the gap between the macro and the micro.
Thank you. Dr. Balsari, my next question comes to you. The flexibility with which you undertook this project is very inspiring, and also shifting from a kind of quantitative and qualitative survey methodology into an exhibition, I think is so fascinating. And from Kapilaben's testimony about how she felt that it was really supporting voice, visibility, and validation is also very moving. Can you say a little bit about like your prior experience or not in doing this kind of exhibition, and then also the process around shifting, or how you thought about that?
No prior experience whatsoever. It was a gradual process. Not here to be a mascot for the university, but I think the interdisciplinary conversations that universities like ours allow are important to acknowledge. I've had the opportunity to teach with colleagues across campus for the last few years that have been professors in the Romance languages and urban planners and business school professors. So I think just personally, I was lucky that I was exposed to interdisciplinary conversations. I think those of us engaged in global health research have always had to forge partnerships to bring in expertise that we don't have. And I suppose this was all in the subconscious. I was stuck with those oral histories. I felt completely inadequate to translate what I was hearing into into papers that would do it justice. Part of it is also because of what we have done to qualitative research. We've almost brought in quantitative tools to deal with qualitative research. We use software, we're extracting sentences, essentially, sentiment analysis generates frequency tables, and it doesn't capture the pauses, the tears, the hesitation. And I felt that these testimonies just needed to be as raw as possible. So we first began by working with SEWA to see if it could be opened up to a larger audience. I thought that a lot of other researchers, as well as other SEWA members and folks that they wanted to work with, should have access to these testimonies, not just I or the team. And with SEWA's support, we have donated the entire collection of oral histories to the Harvard Countaway Library of Medicine and the History of Medicine archives, so that folks from around the world can tap into it. So that was the starting point, Luis, and then it's really the students that goaded us along. They were students that took that interdisciplinary class, and they said, well, isn't this what you all taught us to do? So let's figure out a way to do it. And we had students from the GSD, from the Kennedy School, from the Med School, from the Public Health School, that all contributed to various installations.
Thanks. I have one more question for you all before we kind of move into closing thoughts, and it's about working across communities, maybe working across languages, and it's combining a couple of questions from the audience about how best to try to do that work. I know that, Manshi, you mentioned, those grassroots researchers helped the women feel comfortable because they were from the same community. And then also, even within countries, there are different communities. Satchit, I hear you speaking some Gujarati, but I'm not sure how fluent are you in that language. Was that relevant for this collaboration? Can you speak to us a little, maybe to give advice, maybe the way to give advice to other researchers trying to work across communities? How do you build that trust and that connection that seems so powerful in what you've been doing together?
Manshi, would you like to go first?
Sure, thank you. No, definitely. I mean, this trust and the respect between communities, researcher and the respondents is really, really important. The respondents need to actually believe that the researcher has your best interest in their heart. Only then they will respond in a better way. And Satchit, by speaking our language, understanding SEWA definitely help. But in our experience, what I feel is that, and that was our advantage. But if there is a situation where it is two different organizations not having that kind of advantage point, I feel that it is very important for the organizations to understand each other's philosophy first. There is an importance for the academia to partner with the local organizations, the community leaders, who can then be a bridge between the academia and the grassroots. And that can help in building the confidence, the trust and the security, which will help the respondents to open up and share. At the same time, there is also a need to of course, that's the research. You are all from the research field and you know it very well. But what you are hearing versus what you are seeing also is very important. And therefore, I would say that at any point of time, a telephonic research would be lesser effective as compared to an in-person physical research where the respondents and the researcher are face-to-face. That also, the body language helps in building confidence and sense of security also.
Thank you for sharing that. I think we have to show up. Luis, you have worked for years with Partners in Help, and Paul Farmer always talked about accompaniment, right? And the rest of us can only, aspire to accompany the way he did. An important part of this is to immerse oneself in these environments as we recognize here. I would very much like that to sort of be the message to students and to coming generations. There is a tendency to begin with a data set rather than begin with a question that the community has. There is a tendency to do Zoom calls because they are so convenient, but not showing up. And it is important to be present to fully understand context.
Well, maybe what I'd like to do in our last 2 minutes is to pass to each of you to give any closing thoughts or anything you had wanted to say to our audience that you didn't have a chance to say. And I'd like to start with Kapilaben and then Manshi and finally Dr. Balsari Satchit.
I would like to specifically thank all of you on behalf of the 3 million SEWA members that the partnership has offered the voice validation and visibility to our members, and together hand in hand, we should move forward in this positive direction. The only message I have is that any given intervention and activity designed should be designed taking into consideration the actual impacts of various shocks on members and their lives, on various aspects of their life. And the data at present we have will help amplify the same. Thank you so much.
So I would like to continue what Kapilaben said, and I would like to thank you, especially Harvard Institute, for supporting us with the COVID study and also with the heat sensor study, because as Satchit mentioned, at SEWA, we want the responses now, and it's always, so therefore it is very important to, this study is going to be very important for us. And one last point I want to stress from our work, our partnership with Harvard is that partnerships are really important in today's world of work, where challenges like climate change, challenges like technology, challenges like changes in demographics are turning the entire world of work upside down. And therefore, partnerships between academia, partnerships with multilateral organizations, with governments, with public sector, it's really, really important. And there is a need for focusing on more such partnerships.
A closing thought that what this study did for me is completely changed my notions of what the working poor looked like and what they were capable of. And I realized that it was only the brutality of state and society that prevents them from reaching their full potential. So very much hope that we can continue to work with the poorest and the neediest in the world.
Thank you all so much. This has been really inspiring and informative. I've learned a lot. I'm so grateful for the three of you. I'm especially grateful for our colleagues from SEWA for joining us, and also for our translator. Thank you for helping us to get the richest part of the conversation available. Thanks to all of our audience. We're going to post our video from this session on our YouTube channel in the coming days. Have a great rest of your day, everyone. Thank you so much.
Thank you very much.
Thank you. Namaste.